Good afternoon, everyone. We will get started in just a couple of minutes. We have people coming on now. Thanks for joining us today. And while you're joining us, if you wouldn't mind just putting in the chat your name, state, and tribal affiliation if you have one, and what role you have at your organization. That way we can get to know you and see who's here. Good afternoon, everyone. We'll get started in just a minute. And welcome. Okay, we have a jam-packed hour. We want to give you as much information as possible and leave some time for questions and answers. So let's kick it off. Good afternoon. My name is Melissa Devlin. I'm the Assistant Director here at the Grandfamilies and Kinship Support Network. And thank you for joining us all today on Respite Services and Supports for Kinship Grandfamilies. I just want to give you all a minute. I want to just share for a minute about our work in case you're new to us. Okay. Thank you. So the Grandfamilies and Kinship Support Network was formed as a result of a 5-year cooperative agreement with the Administration for Community Living. And the purpose of the network is to be able to offer technical assistance to tribes, states, territorial governments, and nonprofit organizations that are working to serve kinship and grandfamilies. And we use kinship and grandfamilies interchangeably. Our services are not designed to help families directly because we really feel like organizations such as yours can work in your communities to best serve the needs of your families. But we do help provide information and resources for you to do the best work that you can to serve kinship families in your communities. And there's several different major categories of ways that we help through the network. One of those is through individual technical assistance. We help organizations such as yours with requests for help, and we receive all sorts of different questions about, do you have sample policies, resources, what kind of training resources do you offer for families? And so we have an array of help that we can offer through our partners and subject matter experts. We also have learning collaboratives and information that we disseminate to you through a variety of different ways. One of those is through these monthly webinars. And we're really interested in bringing you all together to share with each other as well, because there's such great work being done across the country. And we want to be able to allow you all a forum to share what's working well, as well as some of your challenges and where you can get some answers from others. So our learning collaboratives do help inform that work. And then we offer a centralized hub for all of you through our Grandfamilies and Kinship Support Network website. We have over 100 newly created resources on a variety of different topics, everything from legal to nutrition to navigation programs, and all in support of your work that you're doing around the country. And so please check out our website, gksnetwork.org. And just click on our resource library. You can look at different topics, or you can also search by keywords. And here is our homepage for our website. You can get information about our upcoming webinars under events, all the information about us, information about Kinship Grandfamilies, and then, of course, our resource library is there as well. Also, at the top, right-hand corner, you see a button for request assistance, and there you can fill out a very short form and let us know what kind of help you need, and our technical assistance team will be back in touch with you as soon as possible. Next slide, please. Okay, and you please sign up for our monthly newsletter if you're not already a subscriber. We send it out once a month, and we share with you all the new resources that we have, and we also share information about resources that are provided by others in the field. Our webinar schedule is on there, and there's just a lot of really helpful practical resources that you can access from our monthly newsletter. So you can scan that QR code and sign up from there, or you can also do that on our website as well. And also, if you're on LinkedIn, please follow us on LinkedIn, and we have up-to-the-minute updates on all the resources that we have offered to all of you. Okay. And then at this time, I'd like to go ahead and introduce our presenters for today. We have a great group of professionals who are doing wonderful work around respite services for kinship grandfamilies across the country. Alber, who is with the Washington State Department of Social and Health Services. She's the Kinship and Lifespan Respite Program Manager. Larry Cooper is Executive Vice President of Innovation for Children's Home Network in Florida. Joe Kagan is the Director of Arch National Respite Network. Some of you may be familiar with the organization, and if not, you will become familiar with it today. And Jill is one of our subject matter experts at the network, given that respite is such an important need for our families. And then we have Kim Vivaldi, who is with the Virginia Department of Aging and Rehabilitative Services, and she is a Human Services Program Coordinator, and she'll be talking today about their respite voucher program in Virginia. So I would like to welcome our first presenter for today, which is Jill Kagan.
Thank you so much, Melissa, for that introduction, and again for the invitation to be able to talk to everyone today about respite for kinship families. Next slide, please. Arch is a federally funded national training and technical assistance center for those of you who are not familiar with us. We are also funded by the Administration for Community Living to provide training and technical assistance to Lifespan Respite Care Program grantees and their state respite coalition partners. The Lifespan Respite Care Program is a federal grant program to states that helps them build or enhance statewide coordinated systems of care. And I'll be talking a little bit more about Lifespan Respite Program in a few minutes. And of course, Arch services are available at no charge to basically anyone, any public or private agency, any family caregiver who needs information or assistance about respite or caregiver support. Next slide, please. I wanted to just start off with the definition of respite because there can be a lot of misunderstanding about what respite is. What you see on the screen is the official definition from the Federal Lifespan Respite Care Act, and that is planned or emergency care provided to a child or adult with special needs in order to provide temporary relief to family caregivers who are caring for that child or adult. But the definition has really become a lot more fluid since COVID, when we had to be a lot more flexible. And so simply put, respite is really just a chance for a caregiver to take a much needed break from their caregiving responsibilities. Next slide. There are all types of respite available as well. There are formal services that provide in-home or out-of-home care, and these might be provided by child care centers, community or faith-based organizations. There are also programs called crisis nurseries that provide respite care and shelter to children from families who are experiencing a crisis or emergency, like a sudden hospitalization or a job or housing crisis. If the child has a disability, of course, there are disability organizations like the ARC, Easter Seals, the Autism Society. They may also provide some community-based services. And then there are all kinds of informal services that may be provided by family and friends, parents or grandparents who share respite care. And again, volunteer or faith-based programs may provide some regular or intermittent respite programs. Next slide. These important resources on this slide are available to help caregivers find respite. And I know many of you are affiliated with Kinship Navigator programs and are here to learn a little bit more about respite opportunities in your state. And for those states where the Kinship Navigator program is aligned with the state's lifespan program or the State Respite Coalition, they may already be well aware of respite care options in the state. And as you know, this may be the very first place a kinship caregiver turns to for respite help. So I hope what you hear today will provide you with some more information if you don't already have it. If a state does not have a state lifespan respite program or state respite coalition, ARCH does have a national respite locator service on our website. There's also the federally funded elder care locator that can help identify an area agency on aging, many of which do provide respite for kinship caregivers. And again, if the child has a disability, it's a good place to turn to. Local disability organizations may provide respite. And if they don't provide respite, they most likely can connect someone to a support group, a parent-run organization or a grandparent-run organization or support group. There's parent-to-parent or family voices. And we've really learned that word of mouth, especially from grandparents or kinship care providers who are on the same situation, really might be the best way to find respite services that caregivers can feel comfortable with. If your state does have a respite coalition or a state lifespan program, they can help you navigate all that might be available in the state. And they also often work in conjunction with the state's Aging and Disability Resource Center or No Wrong Door system. It is called something different in every state, but it is designed to help caregivers navigate the long-term services and supports a system in a state for people of any age or condition. On the next slide, we have a map of where the lifespan respite care programs or state respite coalitions are located. I'll put a link to the map in the chat so you can access their contact information. Next slide. Family caregivers, of course, tell us that a big barrier to respite is the cost of care, especially if the child doesn't qualify for any public funding. Next slide. But there are some private and public funding sources that exist. In the private arena, there are, again, local or state affiliates of disability or aging organizations that serve grandparents that may be able to help pay for respite. There are freestanding community-based respite programs that might provide services on a sliding fee scale. I mentioned crisis nurseries earlier, and they are usually supported by government funds or private foundations, and services are provided at no cost to the family. And then I also mentioned parent or grandparent cooperatives are another option where families share respite care. And we're going to be hearing about a fantastic new model in Massachusetts at an ARCH webinar on Thursday. So if people are interested in that, I'd be happy to add the link to the chat for how to register for that. And then I mentioned earlier, there may be free or volunteer-based respite services. A volunteer program, for example, might be a local mentorship program like Big Brothers or Sisters. And then it's always useful to check out the faith communities that may provide respite volunteers as part of their respite or disability ministry within the congregation. Next slide. There are a variety of public programs that do support respite. Medicaid, home, and community-based waivers are the largest source of federal funding for respite for someone with a disability or chronic illness. There are, of course, is the Family Caregiver Support Program, which I think most of you are familiar with. It's administered in every state through the State Unit on Aging, but more usually through a local area agency on aging. And the program does support respite for grandparents who are age 55 or older, as well as relative caregivers, again, who are over the age of 55 or who are raising children. Other federal programs that might exist in a state are the Community-Based Child Abuse Prevention Program, often supports community-based respite services in the community. If the child has a special health care need, respite might be covered through the Title V Maternal and Child Health Children and Youth with Special Health Care Needs program. So those are worth checking out in your state. Not every state does use those funds for respite, but some do, and it can be a really valuable source. State-funded respite might exist, especially for children and young adults with intellectual and developmental disabilities. And again, it's best to contact the state disability agency to find out if your state provides that. And then lastly, I saved the lifespan respite care programs. Again, they don't exist in every state, but they can help families pay for respite care, and the eligibility guidelines are fairly broad. Next slide. The lifespan respite program grants are awarded to states on a competitive basis. That's why they're not in every state. And they are designed to build statewide coordinated systems of respite care, regardless of the age or condition of the person that might be receiving care. They most often work, as I mentioned earlier, in close partnership with a state respite or caregiving coalition. Next slide. They're also charged with connecting families to respite. That's a big part of what they do. Building capacity by recruiting and training respite providers, and also conducting public awareness activities around respite and caregiving. State grantees also provide planned and emergency respite, and they might do that through the development of community-based or volunteer and faith-based respite services. But most of the grantees are helping families pay for respite through self-directed respite voucher programs. And sometimes they're called grant programs or stipend programs. Next slide, or reimbursement programs. This option is probably the one that's of greatest value to grandfamilies and kinship caregivers. A common characteristic of the Lifespan Respite Voucher Program is that they serve all family caregivers of both children and adults with any condition. And many of the Lifespan grantees have identified grandfamilies and kinship caregivers as a priority group. I mean, you're going to be hearing about that today from the other presenters. Most beneficial to kinship caregivers is that caregivers usually can be also of any age. They don't need to be 55 or older. Caregivers under age 55 can be served as well. 3/4 of the programs have no income eligibility requirement. And when they do, the income guidelines are fairly generous and allow higher incomes than most other federal programs. Many of the programs, most in fact, are self-directed that allow families to select, hire, and train their own providers from among their networks of family, friends, and community members. And if that's not possible, they will help you find providers. You can find a map of the Lifespan Respite and other state-funded respite voucher programs at the link on the slide, and I'll put that in the chat as well. Next slide. Everything I have discussed today can be found on our robust website at archrespite.org. Just click on caregivers at the top of the page, and it'll bring you to all of those issues that are listed on the left-hand side of the page. Next slide. Finally, I just wanted to leave you with this resource, the 9 Steps to Respite for Grandfamilies. It's available in English and Spanish, and it provides a lot more resources than I had time to share with you today. And I hope it'll be helpful to you. And I'm really glad that you're going to be hearing from other presenters today from our Respite Network who can share how they provide different models of respite care to kinship caregivers. Next slide. Just feel free to contact Arch at any time if you have a question or need some guidance. We're always available. Thank you so much, Melissa, and you can turn it over to the next presenter.
Thank you, Jill. Now we're going to have Alber talk with us about what they're doing in Washington State.
Hi there. I'm Alber. I'm the Kinship and Lifespan Respite Program Manager at Washington State. So we're one of those fortunate states, as Jill was referring to, that has a combination of Kinship Navigator and the Lifespan Respite Program. And they're both under my management. So it's nice that we can really marry those two programs together because there's so much in common. The Kinship program services, I'll talk about it a little bit, just a real brief overview. I'll also give a little brief overview of how we implement our Lifespan Respite program and some of the little offshoots of both of those programs, and then just briefly mention some other respite opportunities. Next slide, please. So our Kinship Navigator program has a couple of different major components. We have our Services as Usual Kinship Navigator program, which has been running through the state since 2005. It's state funded. It's basically an information and assistance model. And throughout the time that we have had this program, we have periodic questionnaires that go out to kinship caregivers to ask what their needs are. And most of those are responding that they need some help with respite services. So this has been an ongoing challenge, of course, not just in Washington State, but everywhere. But this has been reported since we've implemented the program. And then we work with families that are both inside and outside the formal child welfare system to help support them. We also have a case management model that is in the early stages. We are going through an assessment process to help us hopefully become evidence-based, where we've submitted to the clearinghouse and we're waiting to hear back. But this model has a needs assessment that we utilize in that. And here's an example of some of the questions that we ask about the needs and the usage of services for respite. So we ask the caregivers if they're receiving respite through the Division of Children, Youth, and Families, whether they're receiving any respite through the Developmental Disabilities Administration, if they're getting any respite vouchers through the Lifespan Respite Program, if they're utilizing camps and retreats as a method of respite, and if they have any other kinds of activities the youth are participating in, like after school, extracurricular, free recreational activities, etc. Next slide, please. We also have Kinship Caregiver Support Program funds that are available to help support families with durable goods. These are available for those families that are outside the formal child welfare system. This is also state funded. These funds can be used for many kinds of urgent needs for rent or utilities, but also for youth activities and camps. And many families choose to use those funds in that way so that they have a break and the kids have a break. So that's another kind of informal way of using respite services. We also have a Tribal Kinship Navigator program in 7 of the 39 federally recognized tribes in Washington State. And they partner with us at ALTA, and I've listed the 7 tribes here. We have Lummi, Quileute, Makah, Port Gamble, S'Klallam Tribe, Samish, Colville, and Yakima Nation. This is also funded through the state, and they also provide respite opportunities. Some of the programs have a monthly dinner with all kinds of activities for the families that are participating. So that's kind of a little bit of a break, and it also brings families together. They do activities together, whatnot. So lots of culturally adapted things to fit within their environment. So that's another opportunity in Washington State. Next slide, please. So the Lifespan Respite Program has several different portions. We have a respite voucher program, and the respite voucher program folks that are working with that program are based out of an organization that we contract with called PAVE. They do an intake with the families that are interested in receiving vouchers for respite. And sometimes what they're doing is a lot of phone calls and support and whatnot to help kind of identify what the specific need is in the family, what areas they're living in, and if there are programs in their community that they can participate in. They did a lot of pivoting when Jill mentioned, working around the issues of COVID. They did a lot of pivoting to find resources in the community that can help support families. For example, they found some online activities that families could utilize. They found some other kinds of informal circumstances that might be helpful as far as providing respite is concerned. So they do a lot of work in the communities and with the communities themselves to identify ways that can meet the need of the individual. We also have a statewide coalition and many partners that are involved. We're also pleased that we have caregivers themselves participating, kinship navigators participating. So we're really excited about the work that we're trying to do to expand that coalition. And then we have a tribal lifespan respite pilot at Port Gamble Scullum Tribe. They also have a kinship navigator program, which I referred to earlier. And then I'll talk about in the next slide what that lifespan respite program looks like at Port Gamble. Next slide, please. So we decided that it would be a great idea to offer respite opportunities to some of the tribes because we're hearing more and more that tribal members were really hesitant to have outside providers come in and provide respite to their tribal members because there was a lot of distrust, understandably, and they didn't know the people. So they really wanted to be able to bring those services in-house. And again, with COVID, that was even more exasperated because people were really hesitant to have anyone come into their home, especially with their health concerns and whatnot. So we were working with Port Gamble Scullum Tribe to develop their own training with input from our program that provides training or conducts training for paid caregivers. And the tribal members were provided or will be providing the respite within their own community. The funds are provided for respite vouchers for those that need to receive the respite. And we're hearing that this really fills a gap for the community because many of the existing respite programs have eligibility limitations like diagnoses, age of caregivers, that type of thing. So this really fills a lot of gaps for people, or sometimes if people are signing up for development DDA kinds of resources so they could get respite through there, there's a wait period. So this kind of fills that need too, because they don't have a wait period in the same way. And this pilot can be used as a template for other interested tribes. We have another tribe that is starting to explore that option in their own community. So we're really excited to be able to use that as an opportunity for other communities to, fit it within their own individual communities. Some are larger communities, some are smaller. Some are very rural and some are more urban. So it's nice to be able to tailor it to the needs of the community. Next slide, please. So a couple of the other respite opportunities, I just wanted to highlight that we refer to each other's programs because we have so many commonalities and so many opportunities to really continue to do this open communication back and forth and provide resources for folks. It's really nice to be able to have this marriage between the programs. And then we like to make sure that we're connecting people with other kinds of informal services that they might not think of. For example, free activities that are in communities, camps, play groups, before and after school programs, those kinds of unofficial resources for supports. And I don't have any other slides at this point, but I'm more than happy to talk in more detail if anyone wants to connect with me at a later time. Thank you also for putting the links in the about our lifespan respite program in the chat.
Thank you very much, Roz. Appreciate it. And yes, please, if you have questions, please put them in the chat and we will get to them in just a little while. We've asked our presenters to cover as much as they could in a little bit of time, and everybody's doing well. But I know there's a lot of information being left out. So again, feel free to put questions in there and we'll get to them. All righty. Next up is Kim Vivaldi, who will talk about the Virginia respite vouchers.
Good afternoon. My name is Kim Vivaldi. I always like to put in there, I'm a nurse by training and a lifespan respite voucher program coordinator by choice. So I'm glad to be here with you and share our new Grandfamilies and Kinship Caregiver program to you. So any of you looking to start something like this, we have information, available to show you it can be done. Next slide. Like many of the programs that they identified, our Grandfamilies and Kinship Caregiver program started from our Virginia Lifespan Respite Voucher program. So what it is this is an expansion upon our traditional Virginia Lifespan Respite Voucher program. The Kinship Caregiver Voucher Program is designed for grandfamilies or other blood kin relatives caring for a minor child who they have custody of. There's no age limit. We want to really, make sure that people understand that. And I heard Jill talk about that there's no age limit when you go to apply for the Grandfamilies and the Kinship. We do ask that you provide us with information concerning legal custody. The goal of our program has been to, enhance access to respite, understanding of respite, reduce the barriers, and make people aware of the importance of self-care and providing respite to themselves in order to be the best caregiver for these chosen families that have come together. Next slide. Our respite funds are limited to $595 per family. Our initial Virginia Lifespan Respite Voucher Program went through, it started in 2021 and goes through June 30th of 2026. The way we were able to expand our program, our traditional Lifespan Respite Program, was that we got an additional supplemental grant from ACL in 2023. At the end of 2023. And so we at the Division of Aging Services are administering the program and we began accepting applications just in February of 2024. So you can see this is fairly new. And initially we had kind of an initial wave of application. And now, believe it or not, today I've been contacted by an organization to present. And also, we're getting more applications, and we're also starting to reimburse. Next slide. I'd just like to put some of the positive outcomes that have been reported back to us so far on our follow-up applications. You do have to make application. It's a 5-page application, and it very much mimics the initial Family Respite Voucher Program. It's just a different color. It's like a green color. However, if someone goes onto our website and they fill out the wrong one, I'm able to ascertain, okay, are they going for our traditional Family Lifespan Respite Voucher, or are they looking for the Grandfamilies Kinship by what they provide, the information they provide. So those who have followed up with us, the family members have reported the funds provide an opportunity for the children that otherwise the families could not have afforded. They were able to make adjustments because ours is a voucher program. They generally have to pay out of pocket, and then we reimburse them for that cost. However, I was sharing initially, there are some programs where we will coordinate with them to reimburse them directly, but that requires a little bit more legwork on our part. But of course, that is what this is all about, is reducing those barriers. They indicate that they're being seen. So it provides the family members with a peace of mind and a confidence to let them know that, others recognize that it's okay that we need this respite. And the most positive thing they say, listen, I was able to enjoy a moment of silence and relaxation. We had one family member talk about how when they utilized the Virginia Lifespan Respite, the Kinship program, that they were able to go back to just being, a couple for a moment instead of the caregivers and the grandparents to a child. The children, sometimes this is the first time they've ever been allowed to go into any structured type program. And this is providing them and the family with positive input and outcomes associated with that. It is building trust for others adults when we don't know what has brought them to the situation, that it is a grand family raising someone else. So it's the kids build trust and the adults build trust. And mostly a lot of times at the end of it, they say they just had fun. They just had a good time at it. Next slide. So I am a healthcare provider by training. And so some of the things that I've been looking at, because we had done the Virginia Lifespan Respite voucher program for upwards of three and a half years, I was used to looking at disability diagnoses, the information submitting accordingly. When you are submitting information for the Kinship program, we still ask a lot of the same similar questions. So sometimes people will submit their IEP for that child associated with their application, and we're able to move them to the traditional Virginia Lifespan Respite voucher program. Other times, again, it's just custody papers. I don't go chasing that paper trail either way, whichever they provide for us. But I was able to note in the applications that almost all, the large percentage of them, 75% of the Grandfamilies and Kinship families report that they are dealing with some type of hyperactivity, attention deficit disorder. I served as a school nurse for over 25 years working in the school system. And this can be something new for the families dealing with it, as far as, it's just not medication, it's behavioral assessment, and being able to refer to those right places within the school system and in the community is important. Other things I noted within the IEPs and information that they volunteered is a list of diagnoses that you see there. I'd like to point out bullet number 4, complex trauma, complex PTSD. And I believe when we spoke as a group the other day, we talked about that. And that, a lot of times what gets these children to that situation, it isn't just resolved by all of a sudden a safe home with their grandparents. So again, we are adding education. And also when we develop these relationships, when we reimburse them back their money, I'm able to kind of point them back in the school system or other areas within their community that may be able to assist them, and for them to get assistance for these kids, so they all can have a happier and healthier and a better understanding of healthcare. Last slide, please. I have some resources here for you. The typical things that you would see, they're available for you to look at. We do work closely with our Family First Virginia and our Kinship Virginia programs. We appreciate their assisting us and allowing us to work with them and providing insight into, what is going on with the Grandfamilies and the Kinship and the need that's there, and how we at the Division for Aging Services can utilize our respite funds to help enhance quality of life for the whole lifespan. I appreciate your time, and I'll be answering questions if you have any in the chats. Thank you.
Thank you so much, Kim. Okay, and last but not least is Larry Cooper, who will talk about a new respite program in Florida.
Good afternoon, everybody, and thanks, Melissa, for the invitation, and thanks for Jill for all your leadership around respite care around the country. Just glad to be here with you guys today. Next slide, please. So Children's Home Network, for folks that may not be familiar, is a non-for-profit down in the Tampa Bay area, been around since 1892. We've had a Kinship Navigator program for well over 20 years. It's been recently recognized as an evidence-based practice here through the California Evidence-Based Clearinghouse. Like Roz, we're in the waiting period with the Federal Prevention Services Clearinghouse, hoping to get a certification there as well. But we do everything from deep end group care in the foster care system to very front end prevention work with healthy families at our agency, and Kinship has at our agency worked both on the prevention and intervention side, both with informal caregivers and with formal caregivers involved with the dependency system here in Florida. Next slide, please. Learned a number of years ago from our kinship caregivers, as I think Roz or Kim mentioned, is that caregivers were desperately asking for respite care. We also found that probably about 30% of our kinship caregivers were struggling with their own health, having chronic health conditions, obesity, high blood pressure, diabetes, just a number of things that were hindering their care of the children in their care, not knowing that these are going to be full-time, long-term caregiving responsibilities. And so over the last year and a half, we worked with our local funder and developed really a full-blown respite service. We saw the need here locally, and we built a respite and wraparound service model that's really there to promote self-care, reduce the incidences of abuse and neglect, really working on the prevention side, trying to eliminate the need for kids to come into the foster care system at all. So our caregiver support service serves a wide variety of families, including our kinship families, and really places an emphasis on that family choice and voice. Like Jill had mentioned, there's so many varieties of respite, and I'll talk about that in a moment. We really wanted to assist the family in reducing the stress and increase access to all those community supports. Many of the communities we work with in our metropolitan areas are resource rich, but if you're a caregiver with several kids and not a lot of knowledge of resources, it can be a real challenge. We offer limited respite services that are free to the family in a variety of settings. And we really wanted to think about this as we do our kinship families, that idea that we need to build those informal support networks for the long-term sustainability of the family. And we offer that through support groups that we offer both in our new caregiver support and our kinship models. Next slide, please. So for our respite program, we really wanted to target children birth to 13, caregivers that were dealing with a child with a physical disability, social emotional challenges, developmental delays or disabilities, or a caregiver really dealing with an acute situational stress that has really put a strain on the family. As many of our kinship caregivers know, we've run into, a child protective investigator calling in the middle of the night and dropping 3 or 4 children in their lap after an arrest, a domestic violence incident, drug charges, a number of things. And so being able to step in there quickly, put respite into place, put some resources is critical. We can serve kids with underlying medical conditions, but not that are deemed medically stable, because we don't necessarily have any nursing or nursing care on our array of services at this point in time. Next slide. So we really wanted to, really provide, improving those relationships within the household, because obviously a lot of stress in these households. We wanted to reduce that caregiver stress, improve, and help those caregivers set some personal goals, and also set some goals for the child. So respite is not just a babysitter. It's going to be really child focus on how do we develop some social emotional skills, if it's academic or behavioral. We really want to help strengthen that family, strengthen that caregiver. We often run into those caregivers who are really struggling with their health and well-being issues. And so we really wanted to bring caregivers to them, respite caregivers who are going to offer knowledge, empathy, and some guidance to those caregivers, and really give them a nurturing experience. We know how stressful their experiences have been dealing with multiple service deliveries and mental health, healthcare systems, school system. So we really want to make sure we're providing a nurturing, supportive experience for families. And we're using some of the great work that Jill and her team at Arch and University of Wisconsin, in terms of resources, in terms of training our respite providers to really provide a wonderful service to the kids that we're supporting. Next slide. So again, we're providing that wraparound service. We're serving the whole family. We're doing an in-depth assessment, looking at all of the needs of that family, because many times our kinship caregivers are under-resourced. They don't know what they're eligible for in this new role, and having a hard time making those connections. So our navigators on our team are really connecting with resources, helping them apply for services, making those needed connections to those resources that are out there. And we're again offering monthly support groups that are really making it accessible to them to build those informal support networks, gain some support, education, information, and have some fun as well, and providing parent and caregiver education. So next slide, please. We're offering those different types of respite, as somebody mentioned earlier, really having families think about a family selected caregiver. So somebody they haven't really tapped into yet, an aunt, a neighbor, another family member that, could provide a small amount or a large amount of respite time so that caregiver can get a break. We created an incentive where we'll provide a stipend to that family selected caregiver so we can really engage them, give them the resources they need. So finances are not a limitation to them joining and participating and helping that family reduce the stress. We have our professional respite providers that are going to go do in-home services, day, night, weekend. We had a wonderful event this past weekend. We took kids to the Clearwater Aquarium for a respite time out with some lunch and having some fun. And the caregivers got a wonderful break with some of the respite providers providing the care. We can also do that center-based care where we're helping families connect with things like Head Start and other types of early learning centers and getting access to those things they may not have access before. And group care, if there's an emergency, caregivers ill, the child's really struggling behaviorally, we can really step in and create a cool down period and a plan for that child to quickly get back into the home once we've gotten the supports in place and supported that grandparent. So we're really offering a variety of options to that caregiver, which is all family selected. We do a family team conference with the families early on and throughout the course of their time with us to make sure their voice is a part of the decision making in terms of what they want and how they want it delivered. Next slide. So we were fortunate in terms of how we delivered the service. So we have a clinical team that's really looking at assessing the family thoroughly, looking at protective factors. We have clinical team leads that are, making that in-home engagement, looking at what the family's resources are, and then installing our family navigators to deliver the services and resources to the family. And then our respite team to be able to get out there and schedule and be as flexible and available to families as they need it. And then have our support team that's really doing the quality assurance, the training, the recruitment, and the support groups that our team needs for those caregivers out there that, need that extra free time to, get a break, meet others that are going through some of the same struggles and challenges, and really being able to support families the best way that they can. So we've got a robust team. We just expanded our service. We just got another local grant in the Tampa Bay area, as well as 2 local federal grants to be able to provide the service throughout the Tampa Bay area. So it really is a nice hand in hand with our Kinship team and our Kinship navigation service. So again, if you want more information, there's more information online, and feel free to reach out, and we'll have some time here today for some questions. Next slide. There's our contact information for the team. So I'll pass it back to Melissa and look forward to your questions.
Thank you so much, Larry. Thanks to all of our presenters and for sharing your expertise and some of your experiences. We have everyone's contact information here. We are also going to be sending out the slides and a recording of the webinar. So you'll be able to, these are all live links within the PowerPoint. You can click on all these also afterwards. And now, if you would, Ro, just put up the next slide. I want to announce our next webinar, which is going to be next week on July 25th, supporting kinship grandfamilies with LGBTQ plus youth. And there's a QR code there to scan to register, or you can click on the link in the PowerPoint when you receive it. So please make note of that. Hope you can join us. And also now, if you can just put your questions in the chat, and we will get to those as we can. Okay, so I know we had a couple questions that came up during the presentation. So there was a question for Roz on how many respite navigators you have across the state.
So we don't have respite navigators across the state. We have our lifespan respite program, voucher program, and we have primarily one person that does a lot of the intake and working with the voucher participants. I am also available if people have questions about respite. We have kinship navigators across the state. We have them in every county of the state. We're partnering with the area agencies on aging, and they subcontract, some of them subcontract with other providers in their communities. So and sometimes they're more than one person working in a sharing a full FTE. So it might be that there are two navigators in the site, but they're only each working half time. We have maybe 40. I mean, if I'm talking about all the kinship navigators, the tribal kinship navigators and the non-tribal kinship navigators, I'm just taking a shot in the dark with that, but it's an estimate because that changes too, as some of them do. Staffing changes everywhere. Hopefully that was helpful.
Yes, thank you, Roz. So I have a question for Jill. If someone wanted to start a lifespan respite program in a state where there currently is one, is that possible? And if so, how does someone or an organization go about doing that?
Well, the lifespan respite care program itself, to apply for a federal grant, can only go to a state agency. The state agency can be the agency that administers the Older Americans Act, a Medicaid agency, or an agency designated by the governor. And then the state grantee, the state agency must collaborate with a state respite coalition or a statewide respite organization. So the lifespan grant does not go directly to the coalition or to the statewide respite organization, but to the state agency. In terms of getting involved with the coalition, just about anybody in the state can do that, and most of them have very diverse memberships. And I did include the contact information for those coalitions in the slides. Is that what you were asking, or were you asking more about becoming a respite program?
No, that was the question. Thank you, Jill. Okay, there was a question in the chat. Are there measures in place for support for the verified fictive kinship caregivers? And this was specific to Virginia. So are there measures in place for support for the verified fictive kinship caregivers, specific to guidelines established by the Virginia Department of Aging?
Not currently, no. Like I said, the programs are still very new for us, just starting. But what we are requiring is the custody, as I answered in the chat earlier, when someone asked, do they have to be a blood relative? As long as they can show chain of custody, and have that legal verification, we're willing to consider their application at this point. And yeah, so.
Okay, thank you. Just thinking about partnerships, what do you all suggest are some significant partners that you should be really working with as you provide these respite services?
Melissa, I'll jump in real quick. I think one of the things that's clearly underutilized by kinship caregivers is early Head Start and Head Start. It's, sometimes complicated application process. We find a very few are even aware of it, and that how many resources and supports are available within early Head Start and Head Start. So that's one that we've worked to develop relationships with across our kinship navigator programs, just because it's really been an untapped resource. And, it's a lot of wonderful kind of early learning aspects for those kids that have developmental delays, and really prepping them up for kindergarten experiences before, things kind of get out of hand. Because I think for grandparents, a lot of our grandparents often don't put children in childcare or early learning centers. And so by the time they get to kindergarten, they're really underprepared, both socially, emotionally, as well as academically. So that would be certainly one area that I think we could probably do more.
Great, thank you, Kim.
Oh, I was just sharing that we are starting especially in our lifespan respite, where the child statistically has a disability, which is about half, probably maybe a little under, but not much of our Virginia lifespan respite voucher programs. Children with those disabilities, we statistically are seeing a lot of autism. So I was sharing with Jill in the panel earlier that we have recently partnered with them to do direct reimbursement. So the application still has to be applied and we work in conjunction with the Autism Society, and we reimburse them directly, thus eliminating that out-of-pocket cost expense often associated with the voucher program, and opening up measures for people to utilize those respite opportunities.
Okay, thank you. Someone posted a question. I'm curious how much state funding is being allocated to these efforts. Our state has thus far been unsuccessful in getting our legislature to fund any respite, making it difficult to leverage federal funding. Anybody want to take that? Maybe Jill?
We see increasingly, especially the states where we have state respite coalitions, and they might be partnering with other organizations, disability organizations, or AARP, or the Alzheimer's Association within the state, that are being very successful in educating state legislators about the need for respite services, and have been successful in getting some additional line item funding for respite. Not enough, certainly. I think the questioner is correct. It is sometimes really difficult to break into state policy and reach your state legislators, but it's not impossible. We also have a national respite coalition that advocates for policy at the national and state level, and we have lots of tools for how to be an advocate that we'd be happy to share as well. I mean, there are states, South Carolina, Alabama, Colorado, other states have been successful at doing it. So at least we have some models for moving forward.
Bill, I was going to ask you to maybe add to this, the area agencies on aging, they all have the ability to use their dollars for kinship caregivers. They don't always utilize much or any of it. They lifted the cap on it. It used to be a 10% cap of their funds for these families, but I don't know if you've run across more and more states kind of utilizing those area agency dollars to maybe lean into this respite space.
Oh, absolutely. Yeah, absolutely. Area agencies on aging, I think, are increasingly, especially now since that cap has been lifted, and I think there's a requirement that this population be served. So we're going to see more and more. And the Grandfamilies and Kinship Support Network has done a lot to build those partnerships with US Aging and with the AAAs to make this happen. I also wanted to mention, I'm glad you raised that question, because a lot of, I didn't maybe make this clear enough in my presentation, but a lot of area agencies on aging also who can serve the grandparent and relative caregiver population also have respite voucher programs in place that are self-directed programs where grandfamilies and kinship providers can select their own providers. So that's a wonderful not new development, but it's increasingly happening among area agencies on aging as well, these new voucher programs.
Thank you. I want to try to get to one or two more questions, but in the chat, if you can, my colleague put in a link to just do a very quick short survey to let us know what you thought about this webinar and some thoughts around other topics for the future, and just our website address and everything there as well. So just if you could take a look at that. But we did have a question about someone said that they can get their clients all the money in the world, but they're required to find their own provider. And there lies the biggest issue. How are these programs enticing new interests for prospective providers? Good question.
I did put a response to that in the chat that Arch has just released a national respite care provider training program that is all about increasing the capacity to provide more respite providers. We're very well aware that not all families have that social network, a support network that they can turn to provide respite. I mean, that frequently is the way most caregivers prefer to use respite with trusted family members and friends. But when that is not available, we really have to work on increasing the number of respite care providers. So we're very excited about this training. Since it was field tested, over almost 2,000 new providers in 10 states have been trained. We launched it at our National Lifespan Respite Conference in May. So I put a link to how you can find out more information about that training to help build respite capacity in your state. And states are also building respite registries to link those trained providers directly to caregivers. And many of those state registries are listed on our Arch website as well. I know Larry's using it for his program, using the training for his program. He mentioned that in his presentation.
There was a note here in the chat about, having to get reimbursed and the issues around that. And, it's just saying that they have to wait for the reimbursements, and then DHS sees that they get the dollars and they can't automatically count it as income. And then they automatically count it as income and cut everything off first and ask questions later. So I'm sure that is a challenge. It sounds like Kim is quite aware.
There are a few lifespan respite programs that pay the respite provider directly rather than the family caregiver, because that is definitely an issue for family caregivers that have difficulty paying up front for those services. There are also programs like Wisconsin, I'm sure many others, that if there's a situation in which the family caregiver cannot pay up front, especially if they're going to be using their vouchers to help pay for more expensive options like assisted living or an out-of-home placement, that they will be very flexible and work with that family to help meet those specific needs. So again, there's so much flexibility with how lifespan respite care programs can implement these programs. And some of them have really done some innovative things to get around some of those issues. The tax issues, on the other hand, are another barrier. That doesn't seem to be a problem for most family caregivers that our lifespan programs are working with. And maybe Roz and, well, it's not an issue in Washington because they use vetted agencies only for their respite providers. But in Virginia and other states, I'm not sure how, what you're seeing, is that a barrier to family caregivers participating if they have to give you a W-9 and have that income reported to the IRS?
Currently, they are required to give me a W-9, and of course, that going through the fiscal department and all that has its barriers to it. We try to be very conscious of it, and take good care of that personal information. But yeah, it is a requirement, and we let them know that information up front. I see Miss Kathy Dallas ask us, do we have a respite provider list particularly? No, we do not. We really encourage self-directed care at this point, and decision makings. It's kind of something the Commonwealth is, not in that lane yet. But if, as Nick said, we will work directly with an agency. It's just a coordination of care, as I mentioned earlier, through the family, through me, and through the facility, and again, the W-9 involved and all that information. But yeah, we will work with them directly the best way we can.
Okay, well, we are out of time. If I find that there were any other questions that weren't answered, we'll try to get to those offline. But I want to thank you all so much for coming and presenting today and sharing some really interesting information about your programs and inspiring others around the country to focus on developing better respite services for caregivers. And thanks everyone for joining us today. We'll follow up with the slides and the recording by tomorrow. Thanks everyone for joining us. Have a great afternoon.